Okay.
1 second. It's going live, going live, going live. You're live.
Okay. Thank you. So today's panel discussion topic is the pandemic and challenges to productivity. And I'm Paturi, and President of Pan-Asian American Business Council and the CEO of Global Cybersecurity Initiative, and chair for this productivity committee at Capric. And I have Ron Melka, Executive Director, Lions Township Mental Health Commission, and Mike Gabriel, Managing Partner, Stridium Cybersecurity Advisors. And Ron?
Oh,
go ahead.
Thank you, Kazi. As you said, I am Executive Director, Alliance Township Mental Health. I'm also the President of the Association of Community Mental Health Boards of Illinois, as well as an adjunct professor at the Illinois Institute of Technology's Business School. First, I would like to cover what has been the impact of the pandemic on physical and mental health. Then I will discuss how those affect businesses, employees, productivity, and costs. And finally, I'll give some ideas on what businesses, organizations, and corporations can do about this.
Okay, Mike. Go ahead.
Good afternoon. My name is Mike Gabriel. I am Managing Director of Stridium Cybersecurity Advisors. We are an advisory firm focused on both cybersecurity and IT compliance. And I'm going to be talking about the impact of the pandemic on supply chains and some of the challenges we're seeing with supply chains and some of the potential solutions to those challenges.
Okay, COVID-19 has had a profound impact on workplace and is beyond dispute. So as per Australian National University, Australians have lost 167 hours worth of work, each worker, between March and October due to the pandemic. So COVID-19 has disrupted supply chains around the world. And question to Mike, what issues have arisen during pandemic that present challenges to the supply chain?
Sure. So supply chains are tricky things, and there were plenty of challenges before the pandemic for people to address regarding their supply chains. We'll talk about some of those later. But when this pandemic hit, it was a black swan event. This really, because of the global nature of it, created a whole new dynamic. So traditionally, we've focused on things like supply chain optimization, right? To minimize costs, reduce inventories, drive up asset utilization. And that has had the effect, unfortunately, of removing some of the buffers and some of the flexibility that would have been available to absorb the kinds of disruptions we're seeing now. And this is a bigger disruption than would have even been anticipated. But the pandemic has exposed a number of vulnerabilities in our both our production strategies and our supply chains. So we first saw that right in a lack of critical medical supplies, right? Getting things like masks and gloves and sanitizer. Those things became very scarce very quickly. And then that just progressed, and we're still seeing problems that the supply chain, a lack of supply chain is having a huge impact. One of the most recent ones is the lack of chips for automobiles, for automobile manufacturing, and it's held up. There are a lot of cars sitting there waiting just for chips before they can get rolled off the line. It's made vehicles a lot more scarce and more expensive as a result. And then on top of that, you've got, that's on the supply issue. Then it affects the demand side as well, right? So we have things like the panic buying and the shortage of toilet paper that happened right at the beginning of the pandemic that people didn't expect. And that creates additional challenges. So, the response then has to be, greater, how do we handle the greater political and competitive pressures that this all brings on? And there's been a couple, ways that companies have tried to respond to this. One of them is to increase their domestic production versus their reliance on overseas suppliers. Again, that takes time, so it's not an immediate fix by any means. Companies are focused on reducing or even eliminating dependence on risky supply chain sources. Something that is taken greater focus now, and then rethink the use of things that we've done for lean manufacturing strategies, right? That involve minimizing the amount of inventory held in the global supply chains. That was good in some respects. It helped organizations to be more competitive, but it made them more vulnerable to the kinds of supply chain issues that we're seeing now. So companies have this conundrum, right? Consumers, are going to continue to want low prices, especially in a recession, and firms won't be able to charge more. So how do you solve these problems without, and still stay competitive? And that's the big challenge. And so the focus has to be on trying to make the supply chains more resilient without weakening that competitiveness.
Okay, so what are some of the specific challenges companies are facing with their supply chains right now?
So a lot of those challenges revolve around, supply chain, understanding supply chain visibility and supply chain risk. And there are a number of risks that have unfortunately been fairly hidden. So I refer to them as hidden risks. Critical components or sophisticated materials that require specialized technology skills to make, right? Trying to identify those things. The examples would be, the touch screens and those control chips for the automobiles that we were just talking about. Chemicals essential for developing DNA or mRNA-based COVID-19 vaccines and DNA-based drug therapies. These kinds of specialized materials, take front and center in a situation like this. And so making sure, we understand those is going to be big going forward. And we'll talk about that a little later. So the specific challenges are around, understanding the risks, understanding the depth of your supply chain, right? Not only your tier 1 providers, but who are the tier 2, here are the tier 3, because your providers are relying on other supply chain providers, and the better you understand that and have visibility into that, the better decisions you can make about managing your risk. Not having diversity in your supply base is one of the specific issues we're dealing with right now. Over reliance on goods from a specific country or a specific region have exacerbated the problem. And then another specific issue would be around inventory. And we talked about that, lean manufacturing and trying to have less inventory, but having enough inventory and making sure that it's stored in places that are not potential quarantine zones are another strategy right now that's becoming more important. So those are some of the specific issues that organizations are dealing with in response to the pandemic with their supply chains.
Okay. Yeah. Okay, so now I will switch to the labor shortage in healthcare, and recent studies present that pandemic job insecurity taking toll on American worker mental health. And Ron, besides the medical complications of the COVID-19 pandemic, what are the physical and behavioral health issues that could impact productivity?
Well, well over 1 year after the World Health Organization has declared COVID-19 a global pandemic, many adults report undesired changes to their weight, increased drinking, and other negative behavior changes that may be related to an inability to cope with the prolonged stress. This is according to the American Psychological Association's latest Stress in America poll. It shows that a majority of the adults, 61%, experienced undesired weight changes, either a weight gain or a weight loss, since the pandemic started, with 42% of them reporting they gained more weight than they intended. Of those, they gained an average of 29 pounds, and 10% said they gained more than 50 pounds. Such changes come with significant health risks, higher vulnerability to serious illnesses, specifically from the coronavirus, but also with a lot of others. Weight gain exacerbates or can cause diabetes, hypertension, strokes, heart disease, liver problems, various cancers. 18% of Americans who said that they had lost more weight than they wanted to, with the average amount of weight lost was some 26 pounds. Adults also reported unwanted changes in sleep. And that's going to cause problems with concentration, problems with productivity. They also reported increased alcohol consumption. 2 in 3, 67% had been saying they were either sleeping more or less than desired since the pandemic started. Some are very lethargic and sleeping considerably more, but many are very feeling anxious and not able to sleep. Nearly 1 in 4 adults reported drinking more alcohol to cope with their stress. Of those who've been able to get help, parents are more likely than those without children to have received treatment from a mental health professional and to have been diagnosed with a mental health disorder since the coronavirus pandemic began. More than half of the fathers reported gaining weight, and nearly half said that they're drinking more alcohol to cope with stress. If you look at the essential workers, such as healthcare workers and people who work in law enforcement, they say they have had to rely on a lot of unhealthy habits to get through the pandemic. Nearly 3 in 10 say their mental health has worsened, while 3 in 4 say that they have been using more emotional support since the pandemic began. They're more than twice as likely as regular adults who are not essential workers to receive a treatment from a mental health professional and to have been diagnosed with a mental health disorder since the pandemic started.
Okay, what are some of the pandemic-related stresses that have an impact on the health?
Well, the ongoing pandemic, they've made many people more anxious and depressed and susceptible to take extreme steps due to the various reasons, such as job loss, losing a close one to coronavirus disease, or a friend, or someone in their school or church or community, or maybe a neighbor. The lack of social gatherings and isolation, and so on. Doctors have observed an increasing number of cases during the pandemic where people have tried to attempt suicide. A study conducted last year of general population found that 55% of those who took part had significant anxiety symptoms, and more than 1/4 of them were experiencing depressive symptoms. At least 27% of the participants claimed they had considered self-harm or suicide at least once, while 3% said they had reoccurring thoughts. There's a real fear of them getting the illness or their loved ones. They're afraid of contact with other people. If they have been isolated and they're just meeting someone for the first time, they may be fearful. It might even be someone who they worked with for a long time. However, being isolated from them during the pandemic, when they first come out, they may be very anxious to have contact with people. there have been over 4.55 million deaths worldwide due to COVID, 660,000 in the United States. Just think of the families, the friends, the schools, the communities, churches that are all in mourning and fearful that something might happen. These include your employees, they include your customers, they include the people in the communities where you operate. There's a fear of a loss of job, either themselves or a household member. It's become harder to fill vacancies because there's people who are in fear of going back to work, of contacting or spreading COVID, particularly now as the Delta variant sparks outbreaks. It's another twist that we have to experience. About 3.2 million Americans had told the Census Bureau that they weren't employed between August 2nd and August 16th because of concerns about the virus. That's up 30% from the previous poll over the last 2 weeks of this past July. It's as if we're going into another round, and it makes everyone's hope that we had almost seen the light at the end of the tunnel be dashed. And now you don't know what's going to happen in the future, and the anxiety is coming back. More than 3.2 million people say they aren't working because they're worried about getting or spreading the virus. That's an increase of 30% from July. Many people feel burned out, financially strapped, particularly single parents are struggling with this pandemic. Studies have shown that women have been hit disproportionately during the crisis. Of the more than 1 million workers over the age of 20 who left the workforce last September, 865,000 of them were women, according to the National Women's Law Center. While the jobs are being added back, women are still behind in those gains. There are still more than 2 million fewer women in the labor force in October than there were in February. There's a number of other things that people are afraid of homelessness, of evictions, of foreclosures. And that's both on the people who are renting or have the house and the landlords and the banks that manage them. It's as if there's no house safety net for either side. You're forcing low-income households and the owners of those buildings to bear the cost of this pandemic, of being unfair to both parties. You've had a real concern on the workforce with homeschooling and childcare challenges. And there's a lot of data regarding how many people had to become unemployed or limit their ability to work to take care of their kids. Okay,
Ron, I think you listed out a lot of challenges and issues. What has been the impact of the pandemic on the problems of alcohol and drug abuse?
Okay. 1 year plus on, there's increased drinking reported by Americans coping with the pandemic stress. The American Psychology Association reveals that the secondary pandemic health crisis has to do with alcohol and substance abuse. Early in the pandemics, adults in the United States were drinking more alcohol to cope with the stress, those researchers found. And then more than a year later, those early spikes in alcohol have remained consistent through 2020 and 21, and in some cases soared even higher. A new study by RTI International, which is a nonprofit research institute in the Research Triangle Park, was conducted this year. People don't just increase their alcohol consumption, the study found, for a month or two at the beginning of the pandemic. The trend has gone on for over a year. They added that anxiety-induced events like natural disasters have been associated with increased drinking habits in the past, and this pandemic certainly fits that description. In June 2020, liquor sales had surged 21% compared with the same amount in 2019. In November 21, that figure just dropped to almost just under 6%. However, that's bounced back up now in July. Meanwhile, numbers from the United Kingdom show that 1 in 5 people have experienced depressive symptoms and substance abuse, which is more than double the amount seen before the pandemic. About 1 in 18 people with alcohol issues will actually seek support for a service. So you've got 17 people who have substance abuse problems and are not seeking help. So the substance abuse providers, the services are only seeing the tip of the iceberg.
Okay, what are the costs to the employers and businesses of these problems?
Okay, well, first, as an employer, as a business, you have to think, well, why aren't people getting help? If I have a sickness, if I have something wrong with me, I go and see a doctor, I go and talk to someone, I go and get help. Well, the real reason is the stigma, a fear of losing their job, a fear of losing their friends or family members, or putting shame on themselves, shame on others. You probably don't have too much concern if you have your child or grandchild going to someone's house who might have diabetes or a heart condition or high blood pressure. But would you send them if you heard that their parent had depression or the parent had substance abuse or another mental health issue? People are afraid to let people know. They're afraid to go see counselors. There's a lot of stigma, religious stigma, social stigma, shame related with these topics. They're afraid of the shame that might be brought on their family or business prospects if they knew of the secrets that they have regarding themselves, so they don't go out and seek that. This causes a great cost to business. If you think of the absenteeism of all of the problems that the pandemic has caused, increased substance abuse, increased obesity, increased heart and liver and other types of disorders. You see that in absenteeism, you see that in your increased insurance costs, you see that in theft when it has to do with alcohol and substance abuse, or maybe someone in their family has lost their job. So they may be working for you, but they may not have enough money for their rent or their prescriptions or their food. And so you may see increased theft and increased medical costs on those individuals, even for testing. There's exemptions in workplace and school testing in the United States. And some patients have already received bills as high as $200 for routine COVID screenings in some areas. That's according to a Times project, which is tracking the costs of COVID testing. Some of the highest bills are faced by people with COVID, and that can range from thousands to millions of dollars, depending on what's required. Some patients have extended stays in ICUs. They may require lung transplants. If you're insuring those individuals, that could really increase the renewal of your insurance. 72% of large health plans were found by the Kaiser Foundation that they're no longer making COVID treatment free for patients. Employee morale is another cost on your business. It's at its lowest point in years, with many increase in cases, with fear of isolation, morale is dropping. And as I said, we're experiencing another wave with the Delta virus. And it makes people feel that these may go on indefinitely, that we'll face one wave after another as more variants keep going. As an employer, it's also getting harder and harder to find employees. I know with many of the agencies, the healthcare agencies that I work with, they can't find healthcare providers. They don't, many retail places cannot find employees. There have been restaurants that have had to cut back on their employment or even their hours, maybe close 1 or 2 days a week because they don't have the employees to be able to serve that. People are afraid if they're in contact with the public of being exposed to and catching the virus and maybe giving it to their children or their parents or someone else in their family, even if they feel healthy or if they know that they've been vaccinated. So there's an awful lot of costs that are related to your business that you need to be aware of and then plan accordingly.
Okay, Ron, you discussed the costs and costs to the employers and these businesses, these problems. And how does this impact an employee's work and productivity?
Well, it's hard to be productive if you have to take care, if you're working at home and you have to take care of your child who is not allowed to go to school, or the daycare center has closed. You may not have an extended family that can take care of your children. So you're squeezing in your job in between other duties. You may be more fearful if you have a spouse or another family member who was taking care of some of the bills, who was sharing their income, and maybe they're not working at all, and you're the only one who's working. So you've got that worry on your mind. With people isolated, there's been an increase in domestic violence and abuse, which is unreported because those places where they would come in contact with other people have until recently been closed. So the schools made less and less calls regarding child abuse. Domestic violence centers received less and less calls because people were working at home or they weren't working, so they weren't showing up at work with bruises or with other issues. So you've got these unknown issues that are now just starting to come to light as people were venturing out more and more in the past few months. The substance abuse calls, the child abuse calls, the domestic violence calls have increased quite a bit since the schools have gotten back in. The productivity on employees is very hard if they're coming to work depressed, if they're coming to work under the influence of alcohol or drugs, if they're not sleeping at night or sleeping too much at night, and if they're fearful or they don't feel supported, if they're afraid that the business is going to close or cut back or they will be laid off. It's very difficult to rally and try and do your best and support the business or company to the best of your ability if you have all of these other stressors and anxieties on you.
Okay, so now let us switch back to our supply chain challenges. And Mike, are there any other things companies should consider in relation to their supply chains?
Yeah. So before I answer that, I just want to, say, what Ron's talked about here, I've seen in out in the field, right? Working as part of large projects for enterprise organizations where people who are, an important part of that project are all of a sudden gone, and they've been given time off for mental health reasons. And when they come back, a lot of times trying to relieve the stress on them, they're given, reduced responsibilities, but it has a big effect on these big enterprise projects that my organization has been a part of. So I just want to say I've seen what you're talking about in action here, Ron, and it's significant. You also mentioned a spike in alcohol consumption, and I got to think a big portion of that is these people responsible for these supply chains that are dealing with all these new issues, because they're having to really scramble to deal with a lot of them. So there are things steps that can be taken to improve the situation. Unfortunately, a lot of them are not short term; they're more long term. But they will help move in the right direction. One of the things we're seeing is this is accelerating the move away from the traditional linear supply chain into what we call digital supply networks, and that's a series of dynamic, connected, synchronized processes all around a digital core. And it's kind of the future of supply chain. So it gives you some additional tools. And so one of those tools would be allowing you to have better visibility into what that supply chain is. Provide line of sight into the capacity constraints of first, second, and third tier suppliers. Allows you to map your full supply chain, including distribution facilities and transportation hubs, and use that information to start categorizing suppliers as low, medium, or high risk. There are also tools as part of this digital supply network that allow you to make use of machine learning to start finding patterns with this in this data that can indicate where there are risks or where there are opportunities by looking at macroeconomic, geopolitical, or global health, exchange rates, and other factors that are in that data. So it's a way to really get better visibility and then really understand where are these risks and vulnerabilities within your supply chain. They can help you identify, a wide range of risks, not only, a black swan event like COVID-19, but more traditional things like trade wars, an act of war, terrorism, regulatory change, labor disputes, sudden spikes in demand, or things like supplier bankruptcy. So that's going to be part of the answer. Another part of it is to diversify your supply chain, and we've been hearing a lot about that. Once you've identified the risk in your supply chain, you can use that information to address those risks either by diversifying your sources or stockpiling key materials or items. A lot of companies are shifting to what they call a China plus one strategy, where they're spreading production between China and another country which is less vulnerable to the same risks that the original supplier might have. And we're seeing a move to build domestic supplies and domestic suppliers. So there's less reliance on overseas, but those again are things that take quite a while to put in place. So they're not immediate fixes by any means. Another thing is looking at your inventory, and if alternate suppliers are not immediately available, a company can determine how much extra stock to hold in the interim, in what form and where along the value chain it should be held. So that's another one of the strategies that can help improve things going forward.
Okay, Mike. So what steps can organizations take to help them better compete in a supply chain challenged environment?
So it's a lot of things I just talked about, moving to these digital supply networks, looking at risks and inventory, and it's a long-term strategy, but by moving away from the linear supply chain into the digital supplier network strategy, you have a lot more information to work with. It's a more dynamic, connected environment. It brings in input from consumers, so you have a better understanding of what kinds of things you're going to have to anticipate in the near future. And so that's a big part of trying to form a new strategy to be more nimble and more flexible in your supply chain capacity. And I've lost Cassie.
Oh,
I
yeah.
I will say this, the things that we're learning from this are going to be good going forward, because we're going through a very hard situation, but we're learning a lot from it, and we're starting to apply what we're learning in new strategies and things, as we bring on new domestic supplier sources, for instance. It's an opportunity to improve what we already have, right? To automate things that were not automated, and to create new opportunities. So as difficult as this whole situation has been, I do anticipate that it's going to create some real advantages going forward from the lessons learned.
Sure.
Okay, let's switch back to the mental health issues. Question to Ron: what can a business or organization do to address these issues, particularly these health-related issues, to decrease these costs and hopefully increase productivity, particularly the ones that you mentioned before? Yeah.
Well, and we've known for a long time in the field of human resources that morale and productivity are tied together. How people feel about their employer, about their workplace is key to how well that they can produce. So the role of communication during COVID is a key part of your effort to build a safe and productive workplace culture. Since COVID-19 is remaining an issue, it's more urgent than ever. However, this communication will ensure your communication plan covers all of the issues. And as Mike was just saying, that what we're dealing with, what we're designing under this pandemic will make us into better businesses, more productive businesses. Many of them are long-term fixes that will be there after COVID, but will continue to give us benefits. So the first one is honesty. You have to be honest with your employees. The moment your team senses that you've been less than forthcoming, you will struggle to regain their trust. So your communication must be consistent, straightforward, and honest. And it needs to be clear. It needs clarity. You need to be clear on things and not leave vague room for interpretation. Your policies, your procedures, and expectations with COVID must be communicated very clearly. They should know exactly what you expect of them and how they should respond in any situation where, say, COVID exposure could be a factor, or vaccination is an issue, or masking, or whatever. Don't leave it up to the manager. Don't have it different at one site than another site. Don't have a policy that you don't carry forward, or say there's a consequence and then it doesn't happen. And you have to be engaged with your team leaders, with your employees when making these decisions, and communicating with them, and get their feedback on their reactions, the issues, the problems they're having with the people they supervise or with the people who are supervising them. COVID-19 education is very important. Don't assume that every member of your team understands the pandemic or has an accurate interpretation. There's a lot of misinformation out there. And even intelligent people may have adopted some, or others might just be unaware of certain practices or protocols, or just not think that certain things are very important. Consider making COVID-19 safety training available to all of your team. It should include educating new employees and create a supportive work culture that, you're trying to help everyone through this pandemic, that as a company, we're going to be stronger, that the impacts of the pandemic have gone far beyond the health concerns of those infected or high-risk employees, that you understand all of the issues and many of the others that may affect them individually, whether it's anxiety, domestic violence, someone unemployed in their family, or grieving because they've lost someone that they know. What are you doing to provide mental health support to your workers during this time? Are you encouraging them to engage in self-care? One of the strongest treatments for depression is exercise. And are you encouraging healthy lifestyles, healthy nutrition, healthy reactions to different situations that would make everyone feel welcome and included? The effort that you put there will impact your employee brand, your retention of employees, and your recruiting. COVID well-being and remote team management. When you've got people all over and working at home, it's more difficult to deal with their morale, to understand what their problems are. So communication becomes so much more important. You need to create protocols to ensure a healthy culture, not only in your office, but in those that are working remotely. Keep those remote teams in the loop. Again, communication is so important with that. And your response to all of this impacts their perceptions of workplace safety. So the more you communicate with them about what you're doing regarding COVID-19 and that the protocols are understood and communicated well and are very clear, the more safe they will feel to come back to work. Show empathy with them. Explain workplace restrictions, scheduling, other types of problems. Right now, 41% of the people, according to that RTI international study that I had quoted earlier, say they need more time than a week to prepare to return to the office. Among parents, they would need more than 1 week, maybe 2 weeks or 3 weeks. Drug testing, that's one of the issues that have come up. You may need people in certain positions where they will get drug tested. And with the increase with substance use, with the increase in alcoholism, it's becoming harder and harder to fill those positions with the increase in legalized marijuana. Some of the companies that I've heard of hire people, and the first thing they go through is a recovery plan. And then the company supports them in their recovery. If you can't find people who aren't using drugs, in some of the areas that have been hit heavily with the opioid crisis, some companies have gone ahead and hired people who had a substance abuse issue and gotten them into a treatment program as part of their orientation. And maybe they don't really come on the job until after 6 weeks or 8 weeks of treatment. Make the vaccine a condition of employment. Now that it is not in an emergency status, you can do that. And that's very clear. You don't have to ask then prospective workers or other workers, what is their vaccination status? Many businesses already were requiring flu vaccines and other types of vaccines. So there is a legal precedence that as an employer, you can have your employees be vaccinated. I worked at several state-funded Department of Child and Family Services or Department of Human Services facilities dealing with children, dealing with adults, and I had to have a flu vaccine each year as a condition of employment. Now that it is not emergency status, you're allowed to do that. Follow the CDC and your local health department guidelines. There are a lot of people who are not insured. So people coming in looking for jobs, they may not have the insurance, they may not have treatment. One of the things that with the increase of employment, the lack of insurance has increased as well. Medical insurance rates for businesses may climb, especially those with a large number of unvaccinated. In fact, there is a school district in Tennessee that it will pay for those, their insurance will pay for those employees who test positive for COVID and need treatment, but only if they've been vaccinated. If they haven't been vaccinated and they have to go to the hospital with COVID, their insurance does not cover them. Be very clear on the CDC recommendations and follow them. And I could read those to you, but I'm sure that's something that you can look up given our time limitations.
Right. Yeah. Okay. Like, how does this all these the organizations address those issues and all that? And how does this impact the community where the business operates? And how can a business or a company address all this?
Okay, well, you have, you have a chance to communicate your company name to the community. You may live in an area that has, or your company may be operating in an area that has a high rate of COVID, that has a high rate of some of the employee problems we were talking about, those may exist as conditions of society. So there may be a large drug abuse problem in the area. There may be a large poverty problem in the area. And the COVID pandemic exacerbates that. Well, you as an employer can work with the community to address those things. One of the things I talked about was that exercise is an important treatment for much anxiety and many of the mental health problems. Well, maybe your company can partner with local parks or local forest preserves or something to help improve or increase the programs there. Maybe you can have some teams of your employees that are formed, or walking or biking or other types of activities outside of work hours that the employees can participate in. Maybe as a service project, you can take a day where your employees go and clean up a park or clean up a forest preserve or some area that your company then can put up signs and say, we're responsible for this section of the park or this section of the forest preserve. And that will give your company a higher prestige and a higher consideration when customers and officials, maybe zoning or inspectors or people in the community, when they view your corporation or your business and know that you are a partner in their community, they may treat you more positively if you're partnering with them on other projects.
Okay, how can cause-related marketing help?
Well, cause-related marketing is where you take a particular cause and you help highlight that through your own marketing. So say you own a bookstore and you operate a bookstore. Well, what is going to help the community as well as help your business in marketing? Well, maybe you then ask anyone who comes in that if they donate a small amount after their purchase, then you will match that and it will go toward books for the local schools for children who can't afford that. And then you put it in the newspaper, you go to the schools, you bring the books that both your customers as well as your business has donated. Your customers feel good about your company and coming there to buy things because you're helping their community, and you get some news stories and other things on media, on TV, in various articles, and you try and build in how you're helping the community, and yet you're helping your own goals of trying to sell more books and have people read more books, or if it's bicycles, or if it's health-related items, maybe it's a yoga class or a yoga studio or martial arts or some gym that you're running. You find some way that the community can help you support the community in the areas that then your business is operating. And then that creates more customers and more customers, because you're say in the case of a bookstore, you're teaching people to value and to buy more and more books, and they'll come back and repeat that.
Okay, so let us switch back to the supply chain. So Mike, do you anticipate a return to normalcy as the pandemic winds down?
Well, I think there'll be certain things that kind of stabilize, but I don't think we'll ever see a return to where we were. Like I said, I think this is accelerating the move away from the traditional linear supply chain to the digital supply networks, and the use of dynamic tools to help better understand supply chains to a deeper level and understand the risks, use machine learning and things like that. Some things will never change, though. The consumers are always going to still drive competition, right? They want low prices. That's not going to change. So you're still going to have to deal with, how do you create a more resilient supply chain without increasing the cost to the consumer? So the things that are going to be different are gaining better visibility into the supply chain, gaining a better understanding of the different types of risks and vulnerabilities that supply chain has, and focusing more on domestic suppliers for certain critical goods. And then when new supply chain suppliers are building capacity, taking advantage of process improvements, things like automation, to build the most efficient processes that you can. So those are things that will cause improvements in supply chains going forward, and are driven largely from the kinds of challenges that we're dealing with right now.
Okay, Ron, just as we are running close to the end of the session, please give us your final comments. Like, what is a corporate socially responsible company, and how can this model help address the impact of the pandemic on business?
Well, corporate social responsibility, it's a form of private business self-regulation, which will aim to contribute societal goals of a philanthropic, activist, or charitable nature. It's the cause-related marketing that I was talking about, only considerably deeper. It's generally understood as a strategic initiative. It contributes to your company's brand reputation. So it should go through all of the action plans in your strategic plan, and should be tied in with everything that you do. So are you an ethical and responsible company? Are you taking care of your employees, of your environment? Say in the model of the bookstore I was talking about, well, are you making sure that the education of your employees is important, as well as the literacy in your community? So not just by giving books, but are you working on have a representative say on a school initiative, or reporting to the city council on how to increase literacy in your community, and taking care of the society and the environment that surrounds your company. And again, it being a bookstore, their main focus is going to be people reading. So, but it goes through their whole strategic plan on how do they become a socially responsible company in that community, looking at the environment, looking at the community social indicators like poverty or homelessness or other things, and how can you help those? And maybe it's through knowledge, maybe it's through use of your items, or donating surplus goods, or letting them use a site for meetings after you're closed, or some other way. It doesn't necessarily have to be from your bottom line, but how do you partner with your social community to move both your goals plus improve the society that you're in?
Okay, so I don't see any questions from the audience. And so let me see. Let me ask this. The new research from Wharton highlights that across the economy, productivity has actually remained stable during the pandemic, with productivity even increasing in many companies. So any comments from your side, Michael?
Well, I mean, that's a good thing. I think it flies in the face of those who think that working from home is not productive. I think there's been a big change in the attitude towards that. I think companies are going to see a lot of resistance to returning to a corporate workplace now that they've worked from home. And if productivity is not affected, that's a good thing. It's providing a little more flexibility. It certainly probably eases some of the mental health challenges that Ron highlighted, being able to work from home. So it's a good thing.
So Ron, you want to add any? Or
Yes, well, I think, it's kind of a catch-22, and it depends on which business you're in. Certainly, a lot of expenses have dropped because of the pandemic. Travel expenses, some particularly those firms that required a lot of air travel or a lot of meeting space or a lot of office space or conferences or other things. You no longer have those costs. Just in my own office, our budget for face-to-face meetings and supplies for meetings has dropped down to almost zero. So, and our travel costs have dropped. So, in some instances, businesses have benefited because of that. And as Mike said, there's a lot of flexibility and being able to work from home is helped a number of employees. It's, certainly we have a lot of the problems that I highlighted in many of the research things regarding mental health or substance abuse. But, each of those there in that statistic, there's a large chunk that were not impacted or not affected and have benefited. In fact, there's a lot of resistance from those employees who've worked at home in not wanting to come back to the office. And in many instances, not looking at productivity, but strictly looking at span of control or other issues. Companies are calling people back who don't necessarily want to come back to the company, that they were happy being able to be at home and not have as many meetings and not have as many distractions and be able to focus on their work. So I know that there are a number of benefits to what has happened. And I think you're going to see a lot of office vacancies and a lot of reduced costs in meeting, both meeting rooms and meeting times and facilities. So I'm not surprised that productivity of those who are still working have gone up. There is a large number of those unemployed that we still have to face, or those that are underemployed and those that are impacting with many of the problems that I've identified.
Okay. I don't see any questions in our chat. So, okay, I think it's a time for us, we can wrap up. And
Okay.
thank you, Michael, and thank you, Ron.
Thank you, Kazi and Michael.
Yeah. Thank you for the discussion.
All right.
Okay. Yeah, let us close. That is the end of our panel discussion.
Okay. Thank you all for watching.
Thank you. Bye-bye.
Thank you
Bye.
all for watching too.